Hello, class and professors. Our group, Group 1, also known as the Go Getters, created a mental health agency by the name of Second Life Community Counseling Center. And in the following slides, we'll explain a little bit what our agency is all about. The Second Life Community Counseling Center was designed to address the need of those being released from a correctional or residential facility by providing community resources and a continuation of mental health treatment. This is a population in Michigan and the entire nation that tends to suffer from lack of resources and services, which often leads to recidivism and rearrest. This is our call to action. This is related to our mission statement, which is to bridge the gap for services of this population by assisting with reintegration planning, continued mental health treatment, and also prescribing medication as needed. Our vision statement focuses more on ensuring that our hired professionals are providing cultural competent services to assist individuals in need with maintaining a healthy mental well being as they return to the community. Our value statement is to support this population in the ways discussed above in order to promote successful transitional periods from correctional and residential facilities and strive for lower recidivism rates. We have chosen to design our mental health agency as a nonprofit organization. In Michigan, there are several tasks that need to be completed prior to being recognized as a nonprofit agency. We plan to obtain liability insurance or malpractice insurance from Newstar in order to ensure that if a mistake is made by our professionals, that we are able to keep them from directly being affected financially, and also that we are able to provide relief to the individual and their family. This also entails that we will ensure that our professionals are well aware of not only the HIPAA expectations in the state of Michigan, but also high-tech guidelines as well, due to the amount of information that would be provided and recorded through technology. All of this information is located on the michigan.gov website. It is also important as a mental health agency to accept insurance from future clients in order to assist with funding for services. This will be discussed more in detail in future slides, but the important start to this is that obtaining insurance credentials for a private insurance company, such as Aetna, which starts by first submitting a request for services, followed by an application to the Council for Affordable Quality Healthcare, or CAQH, has fewer steps than obtaining credentials through Medicaid. Creating policies and procedures for the agency is also expected in order to qualify as a nonprofit, which will focus on best practices associated with developmental and cultural sensitivity, instrument selection, such as therapy styles and assessments used, and professional competence. Finally, when looking at the credentials and licensure for professionals we plan to hire, we would be seeking clinical supervisors with at least 3 years of relevant work experience, licensed professional counselors with at least 5 years of relevant work experience, and would prefer that they have additional training, such as substance abuse counseling. When looking at securing insurance credentialing, we'll start with Medicaid. Medicaid determines the need for the Second Life Community Counseling Center to be enrolled in services, meaning the need of individuals in the community with Medicaid insurance that require these services. At this time, it is also determined that our agency would be a typical provider rather than an atypical provider, which simply means that we are an agency that provides healthcare services. Next, the Community Health Automated Medicaid Processing System, or CHAMPS, enrollment type is determined. CHAMPS is the online system used for billing and reimbursement services. The Second Life Community Counseling Center would be provided a Type 2 National Provider Identifier, or NPI, number, which is required for organizations such as clinics, group practices, and incorporated individuals who provide healthcare services and receive payment. For MDHHS, the group NPI must be reported in the billing provider loop or field. The Facility Agency Organization, or FAO, CHAMPS enrollment type would be provided to the agency, which means that the Second Life Community Counseling Center provider is an entity that provides healthcare services, such as hospitals, nursing facilities, laboratories, etc., and have a Type 2 NPI number associated to them. After this, we would register the Second Life Community Counseling Center with Sigma Vendor Self Services, or VSS, by providing the EIN and Tax Identification Number, TIN. Sigma VSS is the State Budget Office, or SBO, for the state of Michigan, which controls where the money is going with reimbursements. Finally, we would register for an MI login in order to access CHAMPS. The great part about this is that there is guidance material on the MDHHS website in order to navigate the CHAMP system, to ensure that our professionals who bill for services are informed as to how to proceed. The domain administrator will also be identified, which is the employee that delegates which employees are able to complete different tasks through the CHAMP system. When enrolling in third-party reimbursement services, such as with Aetna, fewer steps are involved. First, a request would be submitted through the Aetna website showing that we are interested in working with their company. Reviewing this request takes roughly 45 days in order to ensure that the need for our services is present in our community. Next, we would complete and submit an application to the Council for Affordable Quality Healthcare, or CAQH ProView, with Aetna listed as an authorized health plan. Once this is completed, we can begin the credentialing process, which ensures that professionals in the agency have the proper training, licensure, certifications, and academic backgrounds. Once this is all completed, the Second Life Community Counseling Center then receives welcome materials from Aetna in order to make the connection known and available to our clients. The next step to look at is record keeping. The Second Life Community Counseling Center will use Advanced MD electronic record keeping software. After reviewing the Software Advice website, which is a website for consumers looking for reviews of different technology-related products, Advanced MD had the highest ratings for customer satisfaction. The software company provides templates for patient charts and medication logs, offers scheduling services for appointments, assists with billing services, and patient forms with DSM-5 criteria. There's also a patient portal that provides client access to session notes, treatment goals, and medication information, and access to schedule appointments on their own. This can be completed through encrypted messaging and/or the use of medical patient forms that are stored, as well as patient records.
Technological services are seen as essential in today's practices, now more than ever as we are facing a pandemic. The first technological service for consideration is the use of electronic health records. The benefit of having a EHR program is that, unlike paper documents, multiple people can access one patient file at the same time. A specific type of EHR that would be invaluable for our agency is Cerner. So Cerner can be used as a central hub of documentation for information. So for example, if you were to go into a patient's file in Cerner, you could have access to their mental health history. So in other words, their psychiatric charts, their medical charts, any court documentation that is along with the individual, as well as treatment plans and therapy notes. Third-party billing is also a technological program that would benefit our agency. The benefit of a third-party billing, so specifically our counseling center likes benefits processing services, that instead of hiring a position that specifically deals with billing, we can outsource our billing to a third party in this case, benefits processing services. Lastly, with any technological program, you want to make sure that everything remains confidential, and that is why encryption is very important. So, if we utilize encryption as well as proper firewall protection, that will keep all of our clients' information confidential. Setting fees for accessible services is another topic we would like to discuss. So, what is important about setting fees is that we, the counselors, will inform clients or patients, however you want to refer to them, as early as feasible it is in the therapeutic relationship about what will cost a certain amount. In addition, our agency will be in a partnership with CCS Fundraising that offers a more creative way for services to be accessible. For example, some nonprofits have voluntary donations so that instead of charging a fee, the client can give a quote gift instead of this fee being charged. At Second Life Community Counseling Center, we offer a variety of counseling services. The first service we offer is our inpatient facility, and this typically is a 3-week inpatient stay that individuals will have once they have been released from a correctional facility. The second counseling service we offer is a outpatient facility, and this will consist of different types of therapy. Third, psychiatric care and testing. This is utilized by working with other facilities so that our care team knows which direction they should go in so that they can be successful in their rehabilitation. Lastly, developmental and cultural services. By having these services implemented, we are making sure that we are attending to each client in a culturally sensitive way. The following slides, we will be going into more detail with each of the counseling services offered.
Patient services, we will be including programs such as the Cognitive Life Skills course, which includes classes such as Thinking for Change. This helps to improve critical problem solving skills, decision making skills, and social intervention skills, all of which will attribute to more success in acquiring employment after their post-conviction, as well as reintegrating them back into their community more effectively by also working on their interpersonal skills and relation building skills. So they're going to have healthier coping skills, healthier relationships with family members or other members within their community, which will work to decrease or reduce the recidivism rates. Another one of the classes offered is the moral reconation therapy. This helps to improve their situation-based decision-making skills, their moral development, as well as assisting those who are a little bit more resistant to different treatment modalities. So with this, we work on impulsivity and being more not being reactive to situations or behaviors or attitudes of other people, and taking into consideration and really thinking through what their thoughts and their behaviors are going to have as consequences. This also ties into the reasoning and rehabilitation, their R&R program. This also works on their impulsive behavior. It increases their understanding of how their behaviors affects others. So the MRT and the R&R go hand in hand on working on impulsive behaviors and understanding what their consequences are for their behaviors and how that affects others by creating and understanding, being empathetic to others. So individual sessions will be based off of the risk that the patient has. So are they aggressive, combative, highly irritable, or do they have a background of violent offenses versus those who do not, and they're a little bit more easier to work with in sessions. And then this also works within group therapy. So based on their level of risk, will base off of which treatment modality they go into for both individual and group therapy. The discussions surrounding individual sessions as well as group therapy will include addiction, employment, family responsibility, and the victimization that they've experienced. Level 1 treatment consists of 11 sessions and has 16 hours worth of material. And that one's for the lower risk patients that we'll house, whereas level 2 is for high risk patients. That consists of 22 sessions and covers 48 hours of material. So the inpatient services has a total care spectrum and is at times very heavily involved with the patient for the highest success rate possible.
There are 4 branches that make up our outpatient services. The first branch is rehabilitation coordinators, and they act as a liaison to the individual when they are released from a correctional facility. So, for example, the rehabilitation coordinator would be the person that is responsible to make sure that the patient is having access to continuous medical treatment as well as any types of programs they want to access so they can live their best life. The second branch of outpatient services is individual therapy. So we at Second Life Community Counseling Center don't just do one specific therapy, there is a variety of them depending what would be most beneficial to the client. One of the specialty individual therapies we offer is eye movement desensitization and reprocessing. This type of therapy is very successful with working with individuals who have post-traumatic stress disorder, specifically in forensic settings. The third branch that makes up our outpatient services is group therapy. So for group therapy, we follow a dialectical behavior therapy approach, which this can be used for a variety of individuals because DBT covers a lot of different topics that our patients can apply to use out in society. Lastly, the fourth branch is substance abuse treatment, which will be offered by certified alcohol and other drug abuse therapists. The substance abuse treatment program is a program that if an individual is coming to our counseling center, we would like to get them enrolled in this program first, as it is believed individuals cannot start working on themselves until they can have a clean state of mind.
Another one of our programs that we will have services available at Second Life Community Counseling Center will be the psychiatric care and testing that we will be offering. So we will have licensed psychiatrists on site that will be available for services such as monthly medication reviews and needs of that patient and other diagnoses that are related to the DSM-5 criteria. And they will be working collaboratively with our therapists as assigned to that patient, going over case notes and recommendations for treatment, and both will be working collaboratively for their treatment planning. But our psychiatrist will be the one working and doing the testing and ensuring that medication needs are being met. So prescriptions will only be written by the psychiatrist, and we will have an in-house pharmacy on site to make it more accessible for our patients so they don't have to go to outside third-party agencies such as CVS or Walgreens. And that way we'll ensure that their insurance is accepted and they're going to get the highest quality of care where there's not going to be an interruption in care, whether it be through their services that we offer, individual or group sessions of therapy, as well as their medication. And pharmacists will be trained to provide information about the medications that are prescribed for our clients and assist them with those needs. So that will just extend the level of care we'll be able to provide for our clients so that they will have all of the information available in the one facility. So our licensed psychiatrists will work directly with the clients as well as the therapist. And both, again, will be working collaboratively and reviewing on a regular basis for any changes within their treatment plan or psychotropic medications that they have for stabilization. Scheduling appointments with the psychiatrists will only be coordinated by our rehabilitation coordinators to ensure that the continuation of treatment is not stressful for our clients. So when they're reaching out to schedule an appointment with their psychiatrist, there's not going to be an interruption in services. There's not going to be frustration or stress involved in it. It's going to be a very streamlined process.
At Second Life Community Counseling Center, our goal is focused on spreading our name to as many populations and backgrounds as we can. We want to do this for multiple reasons and to continue to ensure our nonprofit organization is helping the greater good. By using community outreach programs, we can not only help clients, but help the environment around us as well. Our agency has initiatives designed to help individuals with after-school services for kids to be active, helping clients locate a positive career field, and even just hearing the community members speak their own truths. With these programs and initiatives, we want to ensure that our agency is ongoing and established for years to come, no matter what situations occur. This is where our prevention strategies and crisis management skills come into play. We have designed our prevention strategies to incorporate our own incident commander, and we all can take note from the required guidelines. It is also essential for our staff to be prepared for erratic and crisis situations and understanding how to react to them the best we can as an agency. Having a procedure set in place for different types of crisis situations to occur is essential because it ensures everyone is on the same page and aware of what to do in specific areas. Understanding and cohesion can be very effective changes.
As stated previously, with Second Life Community Counseling Center, we have several community outreach and crisis response plans of actions already in place. So part of our community outreach as a community counseling center, we will have a lead outreach coordinator, and they will be tasked with organizing volunteers and other staff to carry out the agency's goals. These will all be funded by grants. So through that, we're going to be hosting black tie events or other sort of fundraiser events or grants offered through the state or even through the community, that specific county. And through those services that are funded through the grants, we'll be able to provide services to the public that offer relief in times of need. And that allows us to have the capabilities of also having competent professionals and training them and having the highest level of care available for the community. So one of the initiatives that we will focus to work on in helping our parolee population to get back on their feet and to find employment and to foster healthy social skills within their community will be one of the adult job placement services within the Michigan community. The Community Development Program helps adults find employment, so they'll work with a job coach, go through how to write a resume, how to interview for a position, how to fill out applications and find the proper documentation for the applications, and go through step by step to help them find a level of work that will be sustainable and assist with reducing recidivism rates so that they're not falling back on old habits where they were able to get cash in a different way that was illegal and possibly contributed to the fact of their conviction and being housed in a correctional facility.
When responding to community emergencies, it is important to have a protocol set into place. Our counseling center will be using the National Organization for Victim Assistance model, known as NOVA. There are 3 components to the NOVA model. The first one being establishing safety and security. So this would involve connecting individuals with their loved ones and ensuring them a sense of control and safety. The second task is ventilation and validation. Our agency will be providing the individuals who have experienced a crisis to tell their story and have their voice heard, while also validating that it is normal for them to have the reaction and the feelings that they have. The third task in the NOVA model is prediction and preparation. So with the third task, crisis responders would be charged with anticipating future issues and reactions. So, this incident happened here, so how are we going to adapt to this moving forward and providing services to individuals that continue to need support after the community emergency. In addition to this, we will have a crisis response team that this group would go to, utilizing the NOVA model, would go to on scene, whatever community emergency is happening. So, for example, if there is a mass shooting, we would deploy our crisis response team, collaborate with local law enforcement, and they would be able to assist us on the individuals that were the first ones on the scene and which victims may be more vulnerable than others.
Handling mental health concerns during a time of crisis is very crucial to the safety and well-being of clients participating and seeking treatment at the Second Life Community Counseling Center, as well as to everyone else in the community who is suffering. This is why we feel it is so important to have staff that are competently trained in disaster mental health practices. These include the psychological support to prepare for disasters, respond to disasters, and even recover from disasters as well. By having staff trained in this specific form of treatment, individuals who are directly suffering due to a disaster and those who have been affected on a secondary or non-primary basis will also be able to work through to recovery. What is important, though, is knowing this is a treatment plan that can differ with clients based on age and cognitive functioning. There are provided guidelines and tips special to each age range to ensure that message of recovery has been spread across to all types of community members. For example, if we are working with children and adolescents, it is beneficial to use wording that they understand in order to work through their concept of what has occurred. As a mental health professional, we need to be aware of these issues by being emphatic and supportive. Then, our clients are more likely to respond to the needed healing. Our agency is about being able to handle what comes our way, whether that be our clients or the staff themselves. With our DMH practices in line, as mentioned before, we want to focus on the idea of preparation, response, and recovery. This training will inform our mental health professionals how to properly respond to a community in need and offer ways that they can refocus their attention on getting through the traumatic event better. Some skills that our professionals can work one-on-one with community members would be keeping a journal, educating them on others who have experienced similar events, and also encouraging relaxation practices. This allows the clients to see that what they are experiencing has been worked through before and can be done once again. Also, depending on the client, depends on what services we can offer them in terms of healing. Group practices can be used as support groups in several different areas, such as substance abuse, disaster survivors, and even exercise classes like yoga. Having professionals trained in DMH practices will allow for an integration into the community where the population is actually suffering. In times of crisis, it is our goal to go where we are needed. Sometimes it is actually better to go to the public rather than have them come to you in order to make yourself more available to their needs. Also, by having these public gatherings to provide support, we can gauge the community to see what is going on and what help can be provided, such as cookouts, sporting events, and so on. This will allow for adults and children alike to get together and heal with mental health professionals standing by to offer additional support. We realize that when professionals are trained to confront situations like this by being proactive, there is a higher outcome of success with clients recovering from the traumatic event. Not only is it important for employees to be trained in DMH, but it is also beneficial to make connections in the community in order to apply the training. When focusing on children and adolescents, this can be completed in a safe, familiar area such as schools. These ideas are supported by a study which promotes a sense of psychological safety, calming, a sense of self-efficacy, and collective efficacy, connectedness, and instill hope. Having a safe space to work on these goals will provide the child and adolescent with a positive psychological framework, will allow better success with recovery. At Second Life Community Counseling Center, we are mindful that our clients will need some type of variance of service, and we will have that proper knowledge to ensure it is delivered properly no matter what ages we are working with. This is important because the capacity to grasp more abstract psychology concepts emerges gradually during childhood and adolescence, and does the capacity for identifying, communicating, and regulating emotions. Along with focusing on individuals from different developmental areas, we must also be cognizant of families that go through disasters together and the shift in parental roles as they deal with both their families and emotional distress as well as their own. At our agency, we will make sure to have the best training for our professionals and allow crisis situations to be handled sufficiently and compassionately. By working with families, it is our first priority to make sure we are helping them remain strong and keep their trust. This is done first by focusing on the existent parental strengths and knowledge, and then branching out to build up resilience within the family. Along with having staff communicating effectively with the clients from a diverse population and building families back up, partnerships with other local agencies would be beneficial in providing crisis response services to people of all ages. In a recent study, they found that having hospitals and local community mental health agencies partner up both experienced a decrease in length of stay for many different patients, which in turn decreased cost and resource allocation. Having an effective partnership in place within the community adds to the crisis response treatment and can be established and can offer effective and timely care to a wide population, including the young and the old. At Second Life Community Counseling Center, we want to be ahead of the crisis situation. Proper training allows the community to have the resources they need in order to make it through whatever event comes their way. At our agency, we want to make these resources available so anyone can gain the information needed to handle hard times. For example, training in DMH practices can be obtained through the American Red Cross in the form of psychological first aid, the Substance Abuse and Mental Health Services Administration through web-based consultation from their Disaster Technical Assistance Center, and the Federal Emergency Management Agency by instructing professionals as to how the program should be conducted. Not only those, but by connecting with local schools, our agency will also be able to determine practices that they instill from their own school districts and apply them to awareness and protective measures for their children attending, which provides a more prepared approach for safety. For those seeking even further assistance for additional support, mental health professionals can reach out to the American Psychological Association's Disaster Resource Network, where they can get connected to local resources in order to ensure that they are properly trained in the event that a disaster occurs. We truly believe that education is essential in times of uncertainty and properly restoring trust into the community and one another.
As an agency, it is important to have an internal crisis response. So for ours, we will be training both our staff at the front desk as well as our therapists and psychiatrists on site on the warning signs of an agitated or aggressive client, as many hospitals and community mental health facilities will experience one. So it's always good to be proactive and train our staff early on. A lot of the warning signs for an agitated client are related to either drug abuse or intoxication. So their appearance, level of intoxication, if you can smell the alcohol on them, if there's blood stains on their clothing or on their person, are they carrying any type of weapons, their physical activity, are they showing as being restless or agitated, pacing, standing up frequently, clenching their jaw or their fists, biting their nails, grunting, are they showing hostile facial expressions, are they having sustained eye contact with you, are they trying to enter off-limit areas uninvited, within their mood, are they aggressive, hostile, even depressed or lethargic or abnormal within their personality or their typical mood based on their presence within the facility? How frequent are they? Is this normal behavior? So for our workers, it's good to let them know that if they start to experience these warning signs, if they express being fearful or anxious, uneasy, or even show frustration with a client that is expressing the previously stated symptoms, that it's just going to escalate the situation further. So instead, what they need to do is to stay calm, keep their emotions in check, be very passive in their language and in their body language. So they should hold their hands at their side, have their palms facing forward, kind of angle their body at a 45-degree angle, so that you look as non-threatening as possible, that you're not going to initiate any sort of physical contact. Let the client talk out what they're feeling. Are they feeling as though they're misunderstood or nobody is trying to listen to them? Try to acknowledge that. Make sure to ask open-ended questions to keep the dialogue going. Be flexible and use the space for your own protection. So always look where the exit is and position yourself in that way. But don't also try to invade the client's space, as they're going to take that as more of a threat. And during this time, we will ensure that the facility is equipped with silent alarms, so they will push that and initiate it if they feel that the situation is escalating in a way that nobody will be able to de-escalate in a safer manner for any of the clients or staff on site, at which point the local authorities will step in and bring everybody back into order.
A main incentive we have at Second Life Community Counseling Center is to ensure our clients feel they are always supported and advocated for. With so many barriers that come up to prevent individuals from receiving the mental health services they truly need, we want to allow our agency to work with a variety of services to eliminate the blockades and ensure proper treatment of all. Our prerogative will all be to establish our partnerships with local and state law enforcement, hospitals in the community, and the Department of Corrections in Michigan. These relationships will help us establish and guarantee we are covering all aspects of services and resources that cause individuals to sometimes avoid getting help or reaching out to professionals. Not only are these collaborations vital, but having, advocating, and accessible plans to allow clients to navigate themselves and create their own support systems is essential to their treatments too. Our nonprofit is designed to give resources and services to clients who don't have all the resources. We are filling in where they may be lacking and providing them with the appropriate health care. Partnering with the state of Michigan is essential to making sure our agency is established and that clients continue to feel empowered and heard.
One interagency collaboration that our counseling center would like to engage in is a collaboration with local and state law enforcement. The components that would comprise of this collaboration, the first being a reduction of correctional entrance. So trying to break the cycle of individuals that law enforcement come across and find them unruly, but as it turns out, they have a mental illness and therefore incorrectly get thrown into the criminal justice system. So we want to break that cycle. The crisis intervention team is one thought that could be implemented with an interagency collaboration, and this could be applied by having a counselor embedded into the local police department. There are many police departments throughout the U.S. that use this approach where the counselor goes out on the police calls to typically deal with the mental health individual by utilizing techniques to de-escalate them. The second team that could be implemented is the street triage team, was similar to that of a crisis intervention team. The street triage is an approach that involves a mental health worker responding to incidents in a police car like the crisis intervention team, although they also can provide services by having a mental health worker in the police control room and assisting that way. Another collaboration that we could do with law enforcement is training. So we could provide such training to law enforcement throughout the state of Michigan, potentially offering online training or webinars that talks about Mental Health Act, common mental health conditions, and how to communicate with those that have a mental illness. Taking it one step further, with proper networking, we could have the potential to implement this information and training in the state of Michigan law enforcement curriculum. The second interagency collaboration would be with the Department of Corrections. The first component of collaborating with corrections is a training program. The benefits of creating a training program for correctional officers would be to improve their knowledge on working with those incarcerated who have different mental health conditions similar to law enforcement, and how to manage incarcerated individuals with serious mental illness. The second agency within corrections, probation and parole, because research discusses how weak coordination between community correctional agencies and community-based treatment providers is a major barrier to diffusion of medication-assisted treatment. So by collaborating, we would want to improve relations between the groups and support the parolees and their transition out of the correctional system. The last component with corrections is the utilization of the cultural historical activity systems theory, known as CHAT. And by utilizing this, the actions of individuals are described as mediated by tools or cultural artifacts that align with who they identify as.
In order to ensure that Second Life Community Counseling Center can provide continuous care to a population in need, it will be in everyone's best interest to also make a connection with the hospitals in the community. In Michigan, one of our largest local hospital groups is Beaumont Hospital. This is a great source for us because Beaumont Hospital offers several different services for its patients, such as maternity, neurology, rehabilitation, and senior services. By aligning with this hospital, we can ensure that our patients are receiving full circle care. Not only with the full circle care, but by consulting with Beaumont Health, we will be able to expand our horizons through different branches located throughout the hospital themselves. By having a larger group of professionals to work with on crisis planning and interventions, we are able to establish greater communication. By working collaboratively with this group, we can ensure that our treatment plans for our clients meet their needs by using several different avenues of expertise. By using several minds and working together, it will assist with addressing a variety of concerns that may arise with the community members that seek treatment and are continuing their treatment. Not only will this benefit the Second Life Community Counseling Center, but also to a healthcare network that can benefit from the combined powers of primary care and mental health care as well. We can begin a trial approach to this, which would emphasize on target populations with mental health disorders, including psychological therapy sessions following their care, and apply psychiatric treatment to see if any beneficial treatment was found in the patients. By integrating mental health treatment into primary care, patients will be more likely to get through their concerns with the most support possible in order to live a closer to normalized lifestyle. At Second Life Community Counseling Center, we want to allow the clients the ability to have the treatment they need no matter what that may mean. It is vital to look at the full individual and assess what help and treatment levels they are truly needing. In relation to availability of mental health treatment, those offenders released from incarceration were less likely to reoffend or get arrested if they are on medication compliant and receiving mental health treatment. Therefore, we believe by working with this Beaumont Health Network, we would be able to assist one of the main populations that we will be serving as a mental health counseling center, the parolee, probation, and the offender population. Overall, by establishing a connection with the Beaumont Health Network, we will be able to successfully spread the message and care that the Second Life Community Counseling Center has been created in order to address.
Our final section details our local advocacy efforts that we will be working to collaborate on and contribute to within the Michigan area, specifically Detroit. Detroit Rescue Mission Ministries offers several different advocacy local drives within the community, and the rescue mission specifically offers devotions and chapel services that offer individuals a safe space to turn to. Spiritual life counseling is an emphasis on God's willingness to forgive and allows those to seek forgiveness, and that individuals that have been wronged, within God's ability, He'll make all things new. And with this belief, it allows those who feel as though they've been wronged or they have wronged others to seek self-forgiveness or forgiveness from their community or from specific people and work through that. Not only does the Rescue Mission Ministries work in allowing parolees or others within the community to attend services, they also have a local choir that they'll have people work in. So if you're not a singer, it's not so much about being in the choir, but assisting in setting up the stage, being an usher for the services for that day, working in unison with the church in any way, and holding a role within the community. Not only do they offer that, they offer a summer camp for inner city kids. And this program used to be known as the Lakeview Farms Mission. This place offered services for transitioning clients from the city, and it allowed them to cultivate and harvest food for shelters, and this worked to foster engagement within their environment and work to create emotional change within themselves while also working through key core beliefs and contributing factors to their incarceration, such as their drug abuse or other forms of aggression, violence, things like that, by working to offer rehabilitation services, drug treatment, and mental health restoration. And through that, they have a secondary thing not only offered for just the inner city kids, but also adults. So they do have a GED and adult basic education program. And with this, they offer any client who wishes to have a high school diploma or an adult that needs basic education. They have teachers within the community offer their services for nighttime classes or classes at their speed, and works with them one-on-one or within groups to get through the coursework and the material and to take the test and receive their GED or adult basic education that also assists them later in life for employment opportunities as well. So the whole program and the local advocacy efforts work to reintegrate and assist in the transition process from being incarcerated to being a member of your society by offering roles within their community, such as local ministries, as well as within a summer camp and assisting with their education. So this is definitely a program that we would like to find ourselves working in as well to further advocate for the parolee population and others within the community as well. That concludes our presentation of Second Life Community Counseling Center, and the following slides are all of the resources that we use to create the system that we just presented to you. So thank you so much for sticking with us this whole time. And that's it.